Hello po mga kababayan, kumusta na po kayo? So it's been a long time. Well, simple lang ang ano natin ngayon, no? Mag-iingat po tayong mga Pilipino dahil sa China ay umabot na ng mahigit 600 million. Ganon. Parang mga ilang porsyento na rin, mga 20% yata, o more than 20% sa kanilang population ang may COVID. Dahil yung kanilang Sinovac, yung kanilang gamot o yung bakuna ay hindi daw umepekto sa kanila, kaya yan ngayon sobrang dami na ng biktima ng COVID sa China. Panoorin po natin ito mga kababayan, itong balita na ito sa China.
What's the true scale of China's virus surge? An estimate puts the number at 600 million. The U.S. considering new steps to curb the spread of COVID-19 as infections skyrocket in China. A growing number of countries now taking action, from France to Australia. 20 feet, the dangerously close distance between Chinese and American military aircraft. But which side is to blame? North Korea celebrating the new year with missiles, its leader vowing to develop a larger nuclear arsenal. South Korea responds, will there be a nuclear race on the Korean peninsula? And the Chinese ambassador to the U.S. given an unprecedented spotlight at an NBA game. We look at why. Welcome to China in Focus. I'm Ellie Hart, in for Tiffany Meyer. Just how many in China have been infected with COVID-19? Right now, there's no official tally. But some Chinese experts are putting together their own estimates and projections. China's top health body has stopped updating daily infections. Authorities also no longer mass test the public. Two Chinese experts put the infection rate in Beijing at around 80%. One of them is a former top scientist at China's CDC. The other is a member of China's highest-ranking consulting institution in science called CAS. Outside Beijing, infection rates in many big cities have hit 50% and are estimated to jump even higher. That's according to infectious disease specialist Zhang Wenhong. Based on these estimates, an article that's widely circulating inside China is putting the nationwide infection rate at 40%. It estimates almost 600 million people in China have been infected with the CCP virus, which causes COVID-19. This is in line with NTD's research. The U.S. is considering new steps to curb the spread of COVID-19. That's as virus infections continue to rip through China. And a growing number of countries are taking precautions. NTD's Julia Song has the details.
U.S. authorities are weighing testing wastewater from international airlines. The move would help track possible new variants as they emerge. This is on top of the precautions already put in place. The CDC said it would require travelers from China to provide negative COVID-19 tests taken no more than 2 days before boarding a plane to the U.S. A genomics expert said testing wastewater from airlines would give a clearer picture of how the virus is mutating. Belgium and Malaysia said they would test wastewater off planes from China. Meanwhile, Canada, Australia, Israel, South Korea, and Qatar are also imposing restrictions. Passengers from China have to provide negative COVID-19 tests before departure or test upon arrival.
I also want to stress that this is a temporary measure reflecting the lack of comprehensive information right now about the situation in China.
Morocco is taking one step further. It would ban travelers from China, regardless of their nationality. Japan has already started testing travelers from China. On its first day, it found that out of the 92 overseas travelers that tested positive, 97% of them had been to China recently. Over in Europe, the UK and France would require negative virus tests from travelers from China. That follows similar actions from Italy and Spain, though passengers arriving in Spain can skip the test if they're fully vaccinated. Italy is urging the European Union to follow its lead and test travelers from China for the CCP virus, which causes COVID-19. Italy says if other countries don't tighten their rules, its own precautions won't prove effective, since people can travel freely within the EU. The European Union's health agency said mandatory health screenings of travelers from China are, quote, unjustified. EU countries are set to
So yan po mga kababayan, no? Basta ingat lang po tayo, ano? At yung mga Chinese na labas-masok dyan sa Pilipinas, dapat mabantay ng gobyerno yan. Ingat lang po mga kababayan.